Hey, everybody, and welcome to another episode of This Week in Crypto Philanthropy. Nick Mikulewski, Senior Sales Manager here at The Giving Block. And of course, this is your guide to crypto-powered change. I'm really excited for another episode this week. I'm flying solo. Pietro is off doing some great things, but really excited for another very special episode today and another very special guest. So without further ado, let me bring on Lisa Sullivan, who's the Executive Director of Texas Suicide Prevention Collaborative. And the reason that we're having this episode this week is that it's Suicide Prevention Month. So with that, Lisa, thanks so much for joining the show.
Nick, thank you for having me. This is really exciting for us to be able to participate, and we appreciate your support for Suicide Prevention Month.
Yeah, absolutely. So why don't we start right there? Why don't you tell us a little bit about the month, what's going on, and what you all are doing?
Sure. So September is National Suicide Prevention Awareness Month, and our goal here nationally is to get out the word about the preventative measures and steps that we can take collectively to move suicide prevention forward and help connect those who might be struggling find the care that they need. And also to reduce the stigma surrounding behavioral health, mental health, and suicide. This is something that we really do need to have a more open, engaging conversation around to be sure that we're finding folks early, getting them connected to care, and finding the hope, help, and healing that folks need when their tomorrow might not be as bright.
Yeah, fantastic. And you have a great kind of homepage and website. I was looking at it earlier. And can you just, you have some great information that's right on the homepage. And can you describe like why you've set it up that way? And not just from a fundraising perspective, but like you said, for actual, services. Can you just talk about what you're doing there? If someone is curious or, needs any kind of resources, what they're seeing when they go on that page?
Well, thank you for that. A great deal of thought went into how to organize that website because while our organization isn't providing direct crisis care, we know a lot of people who Google suicide in Texas are going to land on our website. So we wanted to have all those crisis resources right up front. And while 988 is the flagship of those resources, we also know that there's lots of interest groups that may have some unique perspectives, such as the Veterans Crisis Line or AgriSafe for our rural and farming and agriculture communities. So we really try to have a one-stop shop where folks could get the information they need and the access to the resources they need in a time in crisis. That was first and foremost. The second area that we focus on is training. And so we have an online training program that's accessible through our website for free. We train about 60,000 people a year in this curriculum to help create those awareness about risk factors and warning signs and things that we can be doing collectively to have steps and measures that we can put in place in our communities.
Wow, fantastic. Well, I guess maybe to kind of take a step back, what's the origin story? How did you find yourself, at the organization, and what's a little bit sort of like the background of you and your work with suicide prevention?
Sure. Well, the organization's foundation really began in about 2001 when a group of 10 community partners came together to formulate the first state plan for suicide prevention. So this was not state agency driven. This wasn't federally driven. This was really community driven advocates that were coming together and saw this need. And so that was the first moments of the organization, and so that evolved over time. And in about 2011, I was working in strategic planning and doing a lot of work with social impact organizations on their planning work, and I kind of got roped into this space. And once I saw the breadth and depth and the technical knowledge that's needed to operate in this space, in terms of capacity building, I was hooked. I just really felt like this is something we could make a difference if we could amplify the coordination and the collaboration across our state. And I came on board, and then there was just a number of projects to work on, and so worked across the education, training, outreach, fundraising pieces of the puzzle.
Amazing. And I guess, following on that, a little bit of maybe a two-part question, I guess. So maybe it's good to go a little bit deeper in like how widespread this issue is across the region today. And you mentioned working closely with those, those partners, those coalitions, and maybe go into a little bit about how these local community-based partnerships are so essential to this type of work.
Sure, because we know, I guess, a couple of things. One is we know when folks are struggling, their first stop probably isn't a crisis center. So that means our community partners, our schools, our law enforcement, our veteran service organization, our higher education institutions, our faith-based communities. This is going to be the first line of defense. This is going to be where true suicide prevention work, that's different than clinical care, but finding out at that localized level and strengthening the fabric of that is so essential. And it's because we lose a Texan to suicide about every 2 hours in our state. That translates to about 4,000 Texans a year. And so while our rate of suicide is slightly lower than the national average, the sheer population that we have makes us about 10% of the total that we lose nationally. So this is an urgent, compelling case that it's all hands on deck. We all need to be involved in this process. We also know it's the second leading cause of death for ages 10 to 34. And it's only behind unintentional injuries, so car accidents, things of that nature. So when you think about it in that regard, it's kind of the top level medical or mental health concern in that age group. We lose about 500 veterans a year to suicide. Um, we also know that about 20% of high school students in national survey work flag that they have thought about suicide in the last year. So think about that from an educator's perspective. If you're in a high school class of, let's say, 25 kids, and you're running through 5 rotations of students a day, you're going to encounter roughly what, 25% or 25 students a day that you're going to be interacting with. So just creating that awareness oftentimes helps everyone keep their radar a little higher in terms of watching out for warning signs or risk factors that might be associated with that. We also have a very compelling situation regarding geography. Texas encompasses 160 million acres, and 130 million of those are classified rural. So you can imagine trying to get into the nooks and crannies of these organizations. It really does. The only way this is going to be effective is if we're all working together and if we're all finding solutions together. And so that's our role. That is exactly what we do. That's exactly what we focus on. We're here to answer the call on providing that technical assistance to help those organizations and communities strengthen their suicide prevention capacity.
Yeah, and when your supporters, see this work and want to support this type of work, where do donations go when someone makes a gift to the collaborative? And can you give us a little bit of a look into how those contributions drive that impact into the community?
Sure. So, this is where it does get a little bit more. We're the behind the scenes players, right? We're the ones answering the calls, like, where do I find this resource? Or do you know anybody that's working in this space? I got a call or an email last night saying, help, we need some Arabic translation done for this particular Suicide Prevention Month document. So it's like we have that network and that capacity to do that. Our funding or we are 100% pretty much donor funded. And so these resources go directly into programming that's occurring based on survey work that we do across these 140 partners. We survey them annually. What are your highest needs? What's your highest priorities? What format would you like that delivered in? Um, uh, how would you stratify that prioritization? If we could only do one thing, what would it be? So it's the one place that we know of that provides that feedback to all of our stakeholders at the federal, state, and local level about what's important and what we're seeing boots on the ground.
Yeah. And
That
as,
training.
yeah,
Mhm.
go ahead. Sorry.
Oh, I was just going to say that training that we do, that online training that we do for 60,000, that's always provided for free. So we provide that as a community service, but that has to be updated every year. People lose their certificates and need help tracking that down. So we provide all of the administrative, creative, and content associated with that. We maintain a resource library, so you're not having to go to 14 different places to try to figure out where to look. So we curate that library pretty regularly to try to be sure we're bringing the best and most recent information. But I would say our flagship project is the Texas Suicide Prevention Symposium. We have been running that for 18 years. And it draws, our philosophy behind that is you can only send so many people to a national conference. So we bring those national speakers here to Texas, and we bring them to share the best practices, learning resources, and such that makes a difference in those local partners and statewide partners. This year, we're October 1 and 2, so any shout outs that anyone can give us on that. But we already have 1,200 people signed up for that. So
Wow.
we are pretty much the third largest symposium of this nature behind national conferences. So we're very excited to play that role in our community.
That's
That takes
amazing.
one Bitcoin. One Bitcoin would fund that whole thing.
Amazing.
So
So yeah, that's a great kind of segue. You just started accepting crypto. Yeah, this is perfect. What kind of unlocks are you seeing?
So, um, what our partnership with the Giving Block has afforded us the opportunity is to reach more people more effectively. So, we've been able to put into place some updates to our current curriculums that we weren't going to be able to fund. We have been able to expand our reach in terms of working groups. So we have a working group in higher education. We have a working group for local coalitions. So it's just those people who are working at that local level. So that's going to afford us the opportunity to hire someone part-time to be able to do nothing but work on local coalitions, because they need somebody that understands their unique needs at that local level. So it's things like that the augmentation of our fundraising to include crypto has really provided us. It has also opened donor us to a whole new world of donors that we would not have had access to otherwise. So that has been an incredible benefit of partnering with the Giving Block.
Oh, amazing. So, okay, so expanding that support network, being able to go deeper into some of those initiatives that might not have been funded in the first place. And I mean, as anybody who's certainly been following this program or, has heard us say at the Giving Block, I mean, it's always, especially right now, crypto donors are so mission driven. They want to support organizations so that they don't see the programs they love get impacted, downsized, reduced, and for an issue that is so prevalent and something that requires so much, like I said, like expertise, deep expertise. It's great to see that crypto donors have been stepping up and afforded you a new way of broadening the mission and getting more resources out there to people that need it.
Well, one way just recently that I think just speaks volumes is the recent match that you all spearheaded for the Texas flood situation. What we know, research shows that in a disaster situation like that, risk for suicide doesn't necessarily go up right away. This is years long of effort that we're going to be supporting those communities through training, through embedding resources and things of that nature. Without that help, we would not be able to do that. We would, we are so appreciative of being able to be part of that conversation and that giving campaign. And I think also a lot of people may not realize just the trajectory of suicide prevention is years. It's not months or it's not weeks. And so we want to be sure that all of our communities that experience disaster or other adverse situations have what they need for the long haul.
Yeah. And I guess, how did the crypto conversation even get on your radar? What was it like for the organization to say, hey, should we go down this road? Any kind of learnings, anything you ran into when you were setting this up?
So it took a bit of education to educate our board about the potential benefits, and frankly, we didn't know, the value that this would provide. But we also knew that the trends were pointing that direction, and so that this was something that whether we executed in, I think it was 2022, maybe 2021. I can't remember
Yep.
when we jumped in the ship, but it was going to be a factor in our philanthropic landscape. No matter if we were in the boat or not, we were going to miss opportunity. And so what helped us in tremendously was in the early days, y'all had the impact funding. So we saw immediate results, which helped build confidence across our stakeholders about the value of the partnership. And then the technical assistance you all provide to help novices like our organization to get onboarded, and not only get onboarded, but that ongoing support, that ask questions or we're bumping into challenges. It's been just a phenomenal resource for us across the board. We really appreciate the support you guys offer.
Yeah, fantastic. I mean, it's what we enjoy doing the most, for our organizations, and it's great to hear that this has allowed you to open up so many new doors. And for anybody who's listening on on the program, not only do we have a lot of free resources available, but as you said, there are no dumb questions here. This is something that is a huge opportunity for any organization across all verticals. But maybe looking forward a little bit, is there what's kind of next for the collaborative? Anything you're looking forward to that's coming up down the line?
There is no shortage of places to jump into. Obviously, we'd like to expand our training portfolio. We'd really like to expand our coalition support infrastructure. I just, with the geography that we have, one office isn't sufficient. If we could do a north, south, east, west sort of quadrant approach, so we have more intimate understanding of our local community needs. But I would say I think one of the things you just mentioned there is kind of like, what's our bold next step? What I see a significant need for, and I've felt this way since we began, and we just haven't had the resources to be able to tackle into this, is the to create a center of excellence around community-based suicide prevention. A lot of these initiatives are often incubated in very small places, Rhode Island, Vermont, Massachusetts, and nothing against our partners there. But if you don't understand the geography of how this works, I'm in Central Texas. I'm 7 hours away any direction from a border of our state drive time. So that's a vastness, and that's an order of magnitude that a lot of states just don't have to grapple with. So if you are a researcher or if you are piloting programs, we could be a really great test incubator for effectiveness and help accelerate the diffusion of these types of new tools, because the change is occurring very rapidly in this space as our data gets better, as our knowledge base gets better, as our experience base gets better. The rate of change is accelerating. And we need to get better feedback faster if we're going to have an impact on rates.
Wow. Well, I guess for the supporters that have been branching out into these new ways of giving, and to speaking to the crypto community in general, I mean, here's another great project. Here's sort of the next place that people can step up and make some of those transformative gifts. We're heading into the year end giving season, so perfect time to announce something like this. So we're going to be really excited to see how this evolves and the kind of new support that this might open up and new channels that might start funding parts of this center of excellence. So that's fantastic, and thanks so much for sharing that. I guess to maybe start to wind up the conversation, is there anything I haven't asked about? Anything that just sort of giving you the floor for other things that people should know, whether it's about the program, what crypto giving can do across other areas of the organization. Happy to let you take it in whatever direction.
So I think a couple of things that came to mind as I was thinking about this first, but before I want to go back to something we were talking about earlier regarding the support the Giving Block gives. I just attended kind of y'all's one-on-one 101 webinar about how to get going in this, just as a refresher. And the fact that you guys continually make those resources available helps us to come back to this when we need that refresher. So I hope other organizations are taking advantage of that for that reason. I guess for me, where I see some potential greater synergies is sort of the cultural tendencies of our organization and how it aligns with the crypto space. So, we're not getting a lot of front and center attention in a lot of places because our work is really behind the scenes. We are supporting people from behind. We are not the 988 crisis center, right? So, or crisis line. So we really appreciate those funders that understand infrastructure, that understand um, uh, the foundational pieces that it takes to build something ground up. And that has been the whole crypto ecosystem, right, from the get-go. So I think culturally, our organization is really aligned with the crypto industry, and we would love to be able to tap into it. I also think that we are also hyper efficient. I mean, having enough suicide prevention resources said no one ever, right? So you have to be really agile and really, really thoughtful and really strategic about where we invest time and treasure. And I really feel like that's what the Giving Block offers crypto philanthropists, is really to think through their strategic giving priorities and provide them with that suite of offerings that give the maximum flexibility to meet their unique needs. And I appreciate that.
Oh, fantastic. Well, to kind of close this out, I mean, for anybody that is, looking to support, the mission, going back to kind of like at the top of the call, the website, I mean, you've got a great like donate button and then donate crypto right there. Super easy. I mean, that's what crypto donors love. The fact that when that moment of generosity strikes, and the fact that I can make a crypto donation in about 20 seconds, it's so simple. It's right there. It's so easy. It's not buried somewhere deep down on a different sub page. I want to join. I want to make this, this gift. I want to support these kind of programs. It's right there. So congratulations. I couldn't, for anybody who's listening here, check out what the organization here at the Collaborative is doing, because it's really, really good. You've taken some of the basic best practices and you're putting them right there into action, which is fantastic. So with that, I guess to close things out, if people want to get more involved, learn about the organization, support you guys during this month, where's the best place they can find you guys and reach out to you?
So we're on, let's see, we're on Twitter, Instagram, and LinkedIn at Stop TX Suicides. So please follow us along on that. If you're interested in this space, if you're interested in learning more, come to our symposium. It's free to attend. And right on our homepage at texassuicideprevention.org, there's a link for registration. So feel free to join in, learn what you can. We have folks coming from every major federal agency that's involved in this. We have state experts and clinical experts that will be presenting there. I think that is for those looking to get in that space is really good. If you live in Texas, reach out to us at admin@texassuicideprevention.org and we'll get you hooked up with your local coalition, because that's the place that it's going to make the most difference from that perspective. It's Suicide Prevention Month, so share the post. Anything you can do to amplify our outreach and our community giving messaging, we would greatly appreciate your support on that.
Fantastic. Well, we'll make sure to share all those relevant links. I know there's a lot of crypto folks in Texas, so all my Texas Bitcoiners there, you heard it here from Lisa. We'll make sure to put those links in the show notes. And Lisa, thanks so much for joining the podcast today and sharing everything that's going on and all the work that you're doing for Suicide Awareness Month this month. So with that, on behalf of everybody here at the Giving Block, thank you, and everybody else, we'll see you next time.